For the first time, though, we do have a little bit of positive news to report. It's been more than a week since the two CEOs of Springfield's two major hospitals and the county health department there did this fairly desperate press conference, which we covered on the show, where they proclaimed that they were in crisis in terms of hospital capacity, and they asked in very plain terms for the Missouri state government to please come help. Please come into the Springfield area and set up an alternative care site there, some sort of field hospital, to relieve some of the pressure on the existing hospitals that are overrun. Again, that was more than a week ago that cry for help went out, and it has been unnerving ever since to watch silence from the state government and from Republican Governor Mike Parson in response. Governor Parson initially basically blamed the hospitals for what they were going through in Southwest Missouri. He gave a press conference yesterday about COVID vaccination, which is good. But at that press conference, he talked about how the real problem is all the doom and gloom from the press. And he attacked all the local papers in Missouri for reporting on the COVID crisis there. He said he was sure that George Soros was putting them up to it. Really? I mean, it's one thing for a governor to beclown himself like that in normal times, whatever, we're used to it. But here's a situation where one corner of that state is begging for help for something really specific. Their hospital system, they say, is overrun, and they basically need to be rescued. They have pulled the fire alarm. This is not the time for the random, George Soros, anti-Semitic, Illuminati, conspiracy theory nonsense, you guys. We can do that later. We actually have a real thing to do right now. We can come back to the crazy later. I swear, I know you love it. But I said there was good news, and there is. Tonight, just as we were getting ready to get on the air, the Missouri state government finally said something in response to that cry for help. They finally said they are going to act. They are sending ambulance teams. They've actually sourced the ambulance teams from Arkansas, but whatever. They're also sending teams of staff and specialized equipment to set up an infusion center. This is really interesting, an infusion center. So people who test positive for COVID, who are at high risk of proceeding to get really sick, people can get monoclonal antibody infusions, just like President Trump did. Those monoclonal antibody infusions, if you get them in time, if you get them after you test positive, but before you have to be in the hospital, those drugs are really, really, really effective at keeping people out of the hospital. And so they are setting up a monoclonal antibody centralized infusion center in Springfield. In terms of setting up an overall new care site, effectively a field hospital, they're still not there yet. Hey, what's the rush? But the government says tonight they have identified a site for such a facility, a hotel in Springfield, Missouri, chosen by the local health department. The state government says they're now asking FEMA to do that. They're asking the feds. So, better late than never. And that is legitimately movement there. Finally, that's good to see it. But as I said, the situation in Missouri continues to get worse at this hour. I mean, at this point, Missouri, according to the federal government, Missouri is one of three states, Missouri, Texas, and Florida, that account for 40% of the new cases nationwide. And that might not be a big deal if there weren't that many new cases nationwide, but in fact, new cases nationwide have tripled in the last couple of weeks. And so for three states to amount for almost half of that, that's really saying something about the size of the crisis.